And I was very young working at a law firm, and I had health insurance through my job, and it was $90 a month out of my paycheck, which seemed reasonable. It covered me and wasn't that big of a deal. And then I got married. And when I went to my employer and I said, "Hey, I need to add my wife to my health insurance," it was $300 a month. And I thought to myself, "Gosh, I'm just adding my wife, and she's my same age. And how do we go from 90 to 300?" But I just sucked it up and did it. And then we decided we were going to start a family. And it was so funny because when I said, "Okay, now we need maternity coverage," because my health insurance didn't have it, it was $1,000 a month, and we couldn't get pregnant for 18 months in order for that maternity insurance to work, to turn on. So in my mind, I'm thinking to myself, I'm paying $1,000 a month for 18 months, and then I can start a family. Who can tell me that I can or can't do that? That's crazy. And so much like you, I started doing some research. We ended up going the cash pay route to have our first baby at the hospital, which was $1,800 cash to deliver a baby at the hospital at the time, which made way more sense. And we had a health share. We joined Liberty Health Share many, many years ago. And ever since then, we've done our second child born on cash pay. We've done the broken arms. We've done the x-rays. We've done the emergency room visits. And it really isn't as scary as it sounds. You just have to know a little bit, and you have to be willing to ask some questions and make it work for you. But it makes way more sense for us to carry a health share at, I think we pay $365 a month for me and my wife and my two kids. And then we cash pay everything else. And our health insurance, our healthcare costs are much lower because we're very proactive about it.